Okay. Hello. Um, my name is Teresa Canizales. So I am going to be talking about hepatitis A, B, and C. So those are the more common viruses that do affect the liver. So when a child is born, they typically get the vaccine for hepatitis A. And this is because they can be more susceptible to this virus right at birth. So if other people are not vaccinated, um, they can contract this. So how people get hepatitis A is if they don't wash their hands and clean their food properly, or if they don't wash their hands before and after they go to the restroom and then they go to eat a meal or something, and if they are not vaccinated as well. So, this can come up in the medical field. So, if you are aware, like if your patient does have hepatitis A, to protect yourself with gloves, make sure you wash your hands, um, and just be aware of your patients, um, and what they have, as well as hepatitis B and C. So this can be contracted if people are using IV drug users, if they share the same needles. Um, there is no vaccine for hepatitis C. There is a vaccine for hepatitis B. You usually get that, like, I think I think when you're older, like 5, 3 or 5, you get that vaccine. Now sometimes that vaccine, like, it'll come up as negative, like, you don't have any more antibodies for that. Um, so you might need to get a vaccine again for hepatitis B. Your body might metabolize it. I've heard this. It's happened to me before, so I had to get revaccinated for that. Um, Hepatitis C can affect the liver, and a lot of people can get it in different ways. It can be either brought on by IV drug users or shared needles, like I was saying, unprotected sex, as well as alcohol, overuse of alcohol. So the damage has already been done to the liver, which causes hepatitis C. Uh, so there is no vaccine for this. There is a way for medication. People can have this treated. I think it can be cured. I know that people can take medication to where they heal their liver. I think it's just a matter of how much damage has already happened to the liver and like what stage that person is at. So I think it's a case to case. It just depends, but they should be following up with their providers and their specialists, making sure that they are taking the right medication as well as getting lab draws. That's super important to make sure their levels are where they need to be, or if something needs to change in their care. So these are things that we will obviously run across when we go to the hospital or just do our clinicals, or even as nurses, like um, come across patients who have hepatitis. So they shouldn't be discriminated. They shouldn't be like, oh my gosh, you, like, I don't want to go near that person. Like, you can still um, have normal interaction. Just make sure you wash your hands, be cleanliness around them, and then provide the best care as possible. So that is just a small bit that I got out of this module. That's it. Thank you.